So 2018 clearly is a very, very interesting year for the space of systemic therapy for hepatocellular carcinoma. We had one drug, Sorafenib, for about 10 years, and we had the regorafenib approved in the second-line setting. And also, we heard from ASCO the presentation of Sorafenib in comparison with Sorafenib in the first-line setting, which demonstrated the non-inferiority. With the data, the agent is actually going through the regulatory approval process. For the second-line setting, nivolumab, a PD-1 inhibitor, actually got the FDA approval based on the impressive response rate and duration of the response. So in the United States right now, we actually have 3 agents, one in the first-line setting, i.e. Sorafenib. In the second-line setting, we have regorafenib, we have nivolumab. And as you can actually really appreciate that this field is also moving. At this meeting in GI ASCO, my colleague Dr. Abu Alfa just presented the data of another interesting agent, cabozantinib, in comparison with placebo, which also demonstrated the improved median overall survival benefit. And interestingly, for this study, in addition to receive prior Sorafenib, and a quarter of the patient also received a second-line agent as well, in addition to Sorafenib. And the median survival appears to be holding true in the entire cohort. So I think with the data, I think it's very likely that this agent will also, be actually approved in the second-line setting. So all of a sudden, potentially in 2018, we'll have 5 systemic agents, 2 being in the first-line setting and 3 in the second-line setting. So I guess this is really bringing a lot of treatment options for our patients, who really desperately need these very active drugs for the control of their disease. I think the question and the challenge facing all of us in the field is, how do you sequence these drugs? Would you come up with a predictive biomarker to select the particular agent, one versus the other? And also, how do we really monitor and manage the safety profile of these patients? Because I think that will be actually a very important aspect, for patients receiving these drugs. And in the end, I think, we're still hoping to bring additional novel agents as well as combination strategies so that we can really improve the outcome for patients suffering from this very deadly disease.